Okay, go ahead.
Okay, advocacy, organizations in the healthcare industry. What is advocacy? According to dictionary.com, advocacy is the act of pleading for, supporting, or recommending active espousal. In the healthcare platform, advocacy encompasses direct service to the individual or family, as well as activities that promote health and access to healthcare in communities and the larger public. What is an advocacy organization? An advocacy group is an organization that attempts to influence public policy without putting up candidates for election. Advocacy groups exist along a spectrum that runs from broadly ideological to extremely issue-specific. Professional membership organizations. These associations are health-related organizations consisting primarily of individuals or of state and local groups of individuals, meeting stated qualifications of training or experience. Other membership associations are health-related associations of individuals or institutions, including alliances and coalitions. How do you advocate? Is this your part?
I think so.
Okay.
So how do advocacy and professional organizations differentiate? Advocacy groups encompass direct service to individuals or family, support the rights of the patient. They help build the capacity to improve community health and enhance health policy that are focuses on available, safe, and quality care. They address the challenge of patient-centered care in our complex health system. Advocates work directly in patient care environments, including hospitals, community health centers, long-term care facilities, patient services, profit organizations, or in private independent practice, and they work for positive change in the healthcare system. And professional advocate organizations, in the Code of Ethics of the Professional Patient Advocate Institute, it states that it is an organization or community aligned among the common cause of providing advocacy for consumers as they strive to secure their healthcare needs and cover their insurance and financial matters. There's some different advocacy groups and organizations. Katie actually found these ones if you want to go over them.
Okay, so the first one is Physicians for a National Health Program. This is an organization of healthcare professionals that support a single-player national health insurance program where the government finances healthcare but leaves the delivery of the healthcare to private organizations. Physicians Committee for Responsible Medicine promotes preventative medicine, conducts clinical research, and encourages higher standards for ethics and effectiveness in medical research. Doctors Without Borders USA, an international independent medical humanitarian organization that delivers aid to people affected by armed conflict, epidemics, natural or man-made disasters, or exclusion from healthcare in more than 70 countries, also known as Médecins Sans Frontières. Families USA, dedicated to the achievement of high-quality, affordable healthcare for all Americans. And then the Access Project, a resource center for local communities working to improve health and healthcare access.
I've found this pretty long list of different advocacy groups that they have, and I know that there's more. Specifically, there's this cerebral palsy advocacy group that I found. I actually have a daughter with cerebral palsy, so that was kind of interesting for me to look through. One of the questions was, are advocacy groups and professional organizations the same? And really they can be. And one example I found was, the American Nurses Association. Their mission statement is, the American Nurses Association is a premier organization representing the interests of the nation's 3.6 million registered nurses. ANA advances the nursing profession by fostering high standards of nursing practice, promoting a safe and ethical work environment, and bolstering the health and wellness of nurses, and advocating on healthcare issues that affect nurses and the public. ANA is at the forefront of improving the quality of healthcare for all. So really, they're a professional organization, but they also work closely in advocating for not just the nurses, but also the public. And here's another list of like professional organizations that I found. And I'm sure that there's more too. To join, these are a couple, oh, that's the same link. Sorry, there I had two different links, but that link takes you back to these previous lists, and these are all links to the websites of each of the organizations. And on the front page of all of them, it says click join now. So if you're interested in joining any group, you can find the list here, or I'm sure you could just Google the specific group that you're wanting and look for the website and figure out on their front page it says join or donate, and so it's pretty easy to do. And that is everything.
I just want to add in, the reason why I wanted to do this is because I have a type 1 diabetic son. So I guess we both understand how important advocacy is with our children's health needs.
Yes.
Awesome. Great work. You covered those topics really well. Advocacy, as you are both very well aware, is a very important part of healthcare. This serves a really important purpose. So thank you so much for that. So I ask each student at the end of these what the most interesting thing was that they learned as they were studying this topic. So we'll just start with you, Melissa, and then Katie, you can answer it as well after she is done.
Okay. I think the most, I don't know if it's necessarily interesting, but it was a little bit harder than I thought it would be to find like good info on this topic, I guess. Google wasn't, like, I feel like I had to dig a lot deeper than I would have thought to find like things for advocacy, and like that's not even a complete list, and I could never find a complete list of all the advocacy groups, and so that was really interesting to me that it's not more available.
I was running into the same thing as I was trying to find like definitions, and I'm just like, okay, I thought this would be a lot easier than it was, but as she had posted those lists, I was surprised at how many different organizations there are to advocate for the different healthcare needs.
Great. Well, thank you both so much for that. I'm going to go ahead and stop recording, but hold on for just